Hello everyone, I am Dr. Preeti Poghen. Today we are going to talk about how to say no in your OSCE stations. Right, so when a patient comes to you and insists on something which is not required or unethical or something that is going to cause harm to the patient, so that is against the treatment, then you have to say no because that is a patient safety point. And when you say no, the patient may also be told to get angry. So your role player may get angry when you say no. But if you handle this no in a good manner, then the station is controlled well, and even if the role player gets angry, you get marks of giving appropriate like having good communication and giving appropriate knowledge along with patient safety, right? So you get marks, you pass there. So how to say no when you have a patient who is demanding unnecessary treatment. Say for example, a patient who is pregnant and 22 weeks in pregnancy, and she is asking for an extra scan. She has had all her scans normal, like her anomaly scan was normal, her NT scan was normal, her both the markers like the double marker, the quadruple marker, all that were done for her, all were in the normal range limits. So why would she ask for a extra scan or an intervention, amniocentesis or something like that? So because if she's saying that she wants it because her friend has had a baby with Down syndrome, and all her scans and everything was normal, like her friend's scans and everything was normal, but still she had a baby with Down syndrome. So she wants to be careful with her baby, and she wants to be sure that the baby doesn't have any problem. Here, of course, because she is a low risk patient and you know that everything has come normal, she doesn't need any intervention. You, of course, have given her all the clinical knowledge of all the screening tests that were done, and said that they are not 100% specific, or they are not diagnostic tests, right? They are all screening tests. Even after that, if the patient is insistent, you may just say that I understand that you are concerned about your baby, and I'm really sorry that your friend has gone through this situation. But with all the history that you have given, and according to the evidence, I don't feel that there is any need of any extra scan or any extra intervention or any extra procedure in your case. However, I would suggest, so you should always give an extra option, because if you stop here that I don't want to give any extra treatment to you, then this conversation might turn upsetting the patient, or it may angry the patient, right? So it may go against you. But if you say, however, I would suggest that you keep an eye on your baby, or you be observant about the baby's movement, and be there with for the treatments, like be there for all the visits, take your medicines at regular time. And if you find that there is any problem in the baby's movement, or you find that there is bleeding, or there is any water gush, then of course you can rush to the clinic, and we can take care of you, or we can help you with that, or anything like that. So you always have to give an extra option to this patient. Like for say example, there's some patient who wants antibiotics, right? So she is having a sore throat, and or some pain in her back, and she is saying that she wants antibiotics for that. Then of course you can say that because this pain is not very severe, and it has been there only for some time, or you don't think that she requires antibiotics, then in that case you can just say, I really don't think that antibiotics are needed. However, if this worsens, then we can actually you can come back and we can think about it, or you can give her an extra option, right? So in that case, so you should, or you can tell her that for this sore throat, you can go for vaporization and nebulization, and all the other remedies, that whatever you can think of, right? So lozenges and everything. So you can just say that, however, I can suggest that you go for all these things, and this can take care of your sore throat, right? So this puts you in a situation, in a neutral situation, and takes care of you in a very difficult thing wherein the patient is actually insisting on something that is not good for the patient, okay, or which goes against the evidence. So you may suggest that the evidence doesn't allow me to do that, but I would still suggest you to go for this. Okay, so this is how you should handle your case whenever you have a difficult patient, and I hope that this tip will help you in your stations. If you have any doubts, let me know in the comments section. Thank you very much for patient listening.